Sexual abuse of children is more common than most people think about. Most people don't even want to think about it, but about 1 out of 5 girls and about 1 out of 10 boys will be sexually abused during their childhood. And what we hope to do to teach parents steps to help prevent and recognize sexual abuse in children. What is child sexual abuse? It seems like a very simple question, but you'll be surprised that a lot of people commit child sex abuse and really claim not to even realize what they're doing. So it's when a person, adult or child, takes advantage of a child in a sexual way. In most cases, the abuser is someone the child knows. An abuser may use force, bribes, tricks, or anything to trap a child to keep the child from telling anyone. So they list some examples of child abuse. Everybody knows about touching a child's genitals over or under the clothes, making a child touch an adult's genitals, mouth-to-genital contact between the child and abuser, adult genitals touching the child's genitals or anus, adults showing their genitals to a child, showing pornographic or dirty movies to a child. These are all forms of child abuse. Using a child as a model to make pornographic movies. Asking the child for sexual contact over the internet. Those are all forms of child abuse. And so what we intend to use this book as a tool to do is say what parents can do to prevent sexual abuse. Of course, the most important thing is good communication with your child. One of the best ways to prevent sexual abuse. This is a dynamic process that starts in infancy and it continues all the way up through adolescence. Many people will wait until a certain age when they see that the child is starting some type of pubertal development and decide, okay, this is the time when I need to talk to them about sex. But this, if you'll notice in the handout, it actually starts at about 18 months of age. And they show that at about 18 months to 3 years, you should teach your child which body parts are private. That is, you can say simple things like parts covered by a bathing suit. Also, it's very important to teach the child the proper names. Breast, vagina, not pocket, but vagina. Penis. So this is at a very early age. Know the adults and children that spend time with your child. Make surprise visits to the babysitter or to the caregivers. You forgot to left something, you came back for it. Then you notice at age 3 to 5, we go along with the child's development. Teach your child about private parts of the body. Children during this time are getting ready to enter into the exploratory phase and may touch their genitals and be curious about the genitals of others. Use these opportunities to teach your child how to show respect in the way that he talks and touches others, even at age 3. Ask for advice. Many sexual behaviors may be normal in this age group, but if a child asks an adult to perform a sexual act or becomes forceful in his sexual behaviors, be sure to call your pediatrician or some other authority for advice. Give answers, but give simple answers. When children ask questions about sex or the genitals, give simple and understandable answers so they know these topics are not off limits. We move up to age 5 to 8 years. Teach your child to respect the private parts of others and expect others to do the same for them. Talk about whom the child can tell if someone makes them feel uncomfortable in whatever setting that they're in. For example, if they're at school, tell them the teacher. If they're in some kind of supervised session in a playground or something like that, make sure that they're told there. Listen when your child tries to tell you something. When the child starts trying to talk, just quiet, comfortable, even if you have to count to 20, and listen and let it come out. Many times children are interrupted before they can get the information out, and they'll just stop and just run away. We notice by the time we get up to 8 to 12 years of age, at this time there should be definitely stressing of the child's personal safety, You should be aware of all the places where the sexual abuse can happen. We teach the parents that, such as video arcades, malls, locker rooms, and out-of-the-way places outdoors. And this is the age at which we teach the parents to really talk about peer pressure. Make safety plans with your child so he knows what to do if that's to use drugs or alcohol, smoke, touch someone sexually, steal, cheat, or bully. Teach your child about sexual abuse. This is a good time that the child is old enough that someone can actually go over this list and explain to them actually what child abuse is, and they're old enough at that age to start to comprehend that. Always know what your child is viewing and sharing on the internet. Keep the computer in a room where you can watch your child. Internet safety, we know, is very important for all children. Then, of course, when we get to the age of 12 to 18 years of age, this is the age at which we look for teachable moments, as we might call them, to set aside time each way to talk about the good, the bad, and confusing experiences. And of course, these topics can include types of sexual abuse, what is date rape, sexual harassment in chat rooms or schools, pornography, and people who ask for sex through the internet. So you notice what we're doing through the developmental stages, some of this information we're going on over and over again, but we're stressing it a little different at different age groups. Let them know the effects of drugs and alcohol on sexual behavior. Again, here we come back to this respect. Respect for others and by others, stressing the importance of honoring other people's wishes when it comes to how they're treated. Then the other question that this particular information gives to the parents is, how would the parent know if their child is being sexually abused? Most of the time, sexual abuse is first discovered when a child tells someone what happened. Many parents expect their son or daughter to tell them, another trusted adult, soon after the abuse has started, but we know that most children will wait weeks or months. And many times by that time, it's very difficult to document exactly what happened, and especially to prosecute the case. Abusers may threaten or convince the child not to tell anyone about it. The child may worry about what will happen and whether anyone will believe them. The child may feel that the abuse is their fault and that she will be punished if someone finds out. So these are some fallacies that we must do away with. A child's first statement about abuse may be something vague. And that's when you have to really listen to them and think about what they say. And you may not realize until later on exactly what the child's trying to tell you. May be vague and incomplete until they know how others will respond. Abused children may tell a friend first before telling an adult. Children may tell after a personal safety program at their school. Somebody may talk about it, about what happened to little Johnny, and then they realize what happened to them, and they will tell someone. Sexually abused children can have a number of behavioral and physical symptoms. Now, this is quite often that we see in the practice. Children come in with all kind of vague symptoms, and quite often we can trace these back to some type of sexual abuse. Some sexually abused children have no symptoms at all. That's probably the majority of the case, at least not outward symptoms. The behaviors and symptoms listed below are sometimes warning signs of sexual abuse. And these are very important to think about. New fear of a person, even a parent, or certain places. Drawings that show sexual acts. Sudden changes in behavior, such as bedwetting or loss of bowel control. Sexual acts and words shared with other children or animals. Question about sexual acts that are beyond what the child knows or understands. Changes in sleep habits, such as nightmares. We had one child that came and the parent thought that the child was having seizures. And what it was is the child was having a particular nightmare after being sexually abused. And during this time, they were kind of what we call a hypnagogic state, which is kind of halfway between sleep and awake. And the child was so startled, she actually seemed like she was having a seizure.